Gentlemen, let's be real for a second. Have you ever caught yourself wondering, how do those guys in adult films look so massive? Is there some secret trick I don't know about? Or maybe you've stood at the toilet one morning and thought, why is my urine spraying in two different directions like a broken sprinkler? And of course, the silent fear so many men never say out loud. Why do I lose my erection the moment I start overthinking? Is something wrong with me? If any of these questions have ever crossed your mind, trust me, you are not alone. These are some of the most common questions men whisper about, yet almost never feel comfortable bringing up with their doctor. Before we dive in, do me a quick favor. Hit that subscribe button to get real, science-backed men's health advice without shame, judgment, or misinformation. All right, let's get into it. Today, we're breaking the silence around three issues almost every man experiences at some point: erections that disappear when you overthink, comparing yourself to adult film actors and feeling too small, a split urine stream, weak flow, or unpredictable spraying. In this video, I'm going to explain, clearly and scientifically, what's really happening inside your body when these issues appear. You'll learn why psychogenic ED happens and why it's usually completely reversible, why porn actors look so large and what tricks the industry uses, the medical reasons behind split urine stream, and a step-by-step action plan to rebuild confidence, improve performance, and protect your long-term health. Keep watching until the end because I'll also give you simple, evidence-backed daily habits and tools that can genuinely transform how you feel and perform. Let's start with the real culprit behind erections that disappear at the worst possible moment: your brain. The real science behind psychogenic ED. Most men believe that if their erection drops even once, something is permanently wrong. They panic, they stress, they replay the moment over and over. But here's the truth. For the majority of young and healthy men, erection problems aren't physical, they're psychological. It usually happens like this. The first time your erection falters, it surprises you. The second time, you expect it. By the third time, your mind is so focused on not losing it that your nervous system completely sabotages you. Here's the biology. Erections depend on the parasympathetic nervous system, the rest, relax, allow blood to flow mode. But when anxiety kicks in, your body shifts into fight or flight, the sympathetic system. That system is designed for survival, to run, react, defend, and pump blood to your muscles, not your penis. Those two systems cannot dominate at the same time. If your brain thinks you're in danger, even emotional danger, arousal shuts down. Emotionally, this can feel devastating. I see men all the time who think one bad night means their sex life is over, but it's not. Psychogenic ED is incredibly common, especially in men under 40, and it's extremely treatable. And here's something important. Because the arteries in the penis are some of the smallest in the body, any change in blood flow can appear there before it appears in the heart. That's why persistent ED can sometimes be an early warning sign of cardiovascular issues. But if your heart and hormones check out, then the most likely culprit is overthinking, and you can fix that. Mistake 1: getting stuck in your head during sex. This is the #1 reason erections disappear. You want to perform well, you want to impress your partner, you want everything to go smoothly. But the more pressure you put on yourself, the harder it becomes, literally. When you start thinking, what if I lose it again? What if I disappoint them? What if this happens every time? Your body instantly switches from arousal mode into stress mode. And stress mode and sexual performance do not coexist. Emotionally, this can lead to avoidance. Instead of facing the fear, many men begin making excuses, distancing themselves from intimacy, or pretending they're tired, all to avoid the possibility of embarrassment. And every avoidance adds another layer of fear. Here's what works. Step 1: remove performance pressure. Focus on intimacy, kissing, touch, and connection without the expectation of penetration. This lets your nervous system relax and relearn that intimacy is safe. Step 2: retrain your body. A short-term prescription of low-dose tadalafil can act like training wheels, not to create desire, but to help maintain blood flow while you rebuild confidence and reduce anxiety. Step 3: rebuild comfort slowly. Sex is not a performance, it's an experience. And the more you shift your mindset toward connection rather than outcome, the more your body begins to cooperate again. Mistake 2. Comparing yourself to porn actors. Now, let's talk about something that affects nearly every man, whether they admit it or not: size comparison. Adult films create some of the most unrealistic expectations in the world. The problem isn't just what you see, it's what you don't realize is happening behind the scenes. Here's the reality. 1. Selection bias. Only men with above-average size are cast. It's not biology, it's business. 2. Camera tricks. Angles, lenses, lighting, and editing exaggerate size dramatically. 3. Medical aids. Many performers use vacuum pumps, traction devices, temporary dermal fillers, ED medications like sildenafil or tadalafil, in rare cases, penile implants that allow on-demand erections. These are not natural, and they certainly don't reflect the average man. The global average erect penis length is around 5.1 to 5.5 inches, and nearly all men fall within a normal range. But emotional comparison is powerful. Seeing exaggerated images repeatedly can chip away at your self-esteem and convince you that you're inadequate when you're perfectly normal. Here's what matters far more than size: blood flow, confidence, communication, technique, emotional connection, attentiveness to your partner. These factors play a far bigger role in sexual satisfaction than raw inches. Stop comparing your everyday reality to an industry built on illusions. Focus on your real physiology and the health of your body, not the illusion of someone else's. Mistake 3. Ignoring a split urine stream. Now, let's talk about something a lot less glamorous but extremely important: the split urine stream. Every man has experienced it. You walk up to the toilet half asleep, start urinating, and suddenly the stream splits into 2 different directions. It's annoying, messy, and leaves you wondering if something is wrong. Here's what's actually happening. Most common cause: temporary blockage at the urethral opening. If there's dried semen or mucus partially covering the tip, it can cause the urine to fork or split until the blockage clears. This is especially common after ejaculation and is usually harmless. But a split stream can also signal deeper issues, including benign prostatic hyperplasia, common in men over 40, urethral strictures, scar tissue narrowing the passage, chronic prostatitis, inflammation causing irregular flow, meatal stenosis, narrowing at the tip of the urethra, incomplete bladder emptying. Emotionally, men tend to laugh it off, ignore it, or assume it's just age, but sometimes it's your prostate trying to get your attention. A simple fix is to sit to urinate, especially first thing in the morning. This helps empty the bladder and reduces spraying. But if you notice weaker flow, stopping and starting, nighttime urination, dribbling, or persistent split stream, it's worth getting evaluated. Early detection can prevent bigger problems later, turning this into an action plan. Now let's turn everything we've discussed into a practical blueprint you can start using today. 1. Rule out medical causes. If you're under 40 with persistent erection issues, get a basic evaluation: blood pressure, blood sugar, cholesterol, testosterone, thyroid function. This rules out cardiovascular or hormonal problems that may show up in the penis before the rest of the body. 2. Break the anxiety cycle. Stop treating sex like a performance. Shift towards slow, pressure-free intimacy. Focus on touch, connection, and sensation, not penetration. Therapy or guided cognitive techniques can also help remove the mental failure loop that keeps you stuck. 3. Consider short-term medication support. Low-dose daily tadalafil, 2.5 to 5 milligrams, can serve as training wheels while you rebuild psychological confidence. This is a medically recognized and extremely common approach. 4. For size concerns, focus on function. Cardiovascular health equals erectile performance. Improve fitness, sleep, diet, hydration, pelvic floor strength. Traction devices can produce small but real improvements over months. Surgery, however, has significant risks and is generally not recommended. 5. Address urinary changes early. Track your symptoms. Stay hydrated. Empty your bladder fully. Seek evaluation if symptoms worsen. Early treatment is far easier than late treatment. Key supplements and lifestyle tools. While supplements are never magic, several ingredients have strong evidence supporting prostate health and urinary comfort. For prostate function, saw palmetto may reduce DHT-driven prostate enlargement. Pygeum helps nighttime urination and inflammation. Stinging nettle root supports urinary flow. Green tea extract, antioxidants protect prostate tissue. For erectile health and circulation, L-citrulline or L-arginine boost nitric oxide. Omega-3 fatty acids improve vascular health. Magnesium supports smooth muscle relaxation. Vitamin D tied to testosterone and endothelial function. Lifestyle remains the foundation. Daily walking or cardio, pelvic floor exercises, reducing alcohol, prioritizing sleep, managing stress, avoiding smoking or vaping. When lifestyle improvements and supplements work together, you build a long-term foundation for stronger erections, healthier prostate function, and better confidence. Let me leave you with something important. If you've struggled with erection issues, worried about your size, or felt embarrassed about changes in your urination, hear this clearly. You are not broken. These are not signs of weakness, failure, or loss of masculinity. They are signs your body is communicating, asking for care, attention, and understanding. Your body is adaptable. Your circulation can improve. Your nerves can reset. Your confidence can return. With the right knowledge and small, consistent actions, you can reclaim your vitality, your comfort, and your sense of control. So here's your challenge. Comment below one healthy habit you're starting this week, whether it's walking more, drinking more water, reducing stress, or finally scheduling that checkup. If this video helped you feel more informed and less alone, hit the like button. It helps more men find real, shame-free answers. And don't forget to subscribe for more honest, medically accurate men's health content. You deserve clarity, you deserve confidence, and you deserve control over your body and your health. I'm here to help you get there.